Hi everyone, my name is Zuhur Jashi and today I'm going to be presenting my community needs assessment. I am a nutritionist with a bachelor's degree in nutrition and dietetics. I am a licensed nutritionist and I attained my certification as a fitness trainer 2 years ago, and I am currently pursuing a master's degree in applied nutrition. So what is a community needs assessment used for? It is a tool used to identify the strengths and resources available in the community, and it is used to fill the gap that is required by the community in order to meet the needs of the families and the children in this specific community. The community needs assessment, however, requires extensive research about the citizens and the organizations in the community. Its goal is to work hand in hand in order to develop and build the necessary services that will help families and children lead better lives. The process of the community needs assessment is quite extensive, as mentioned. It requires a community team before beginning the process, and part of this community team is establishing a list of stakeholders that are essential for this process. So what are stakeholders? Stakeholders are individuals who have an active role in the community needs assessment, and they work by helping develop questions as well as helping in data collection and the analysis of this information. In this community needs assessment, the stakeholders will be a nutrition professional, a psychologist, a school principal, health worker, a general practitioner, gynecologist, and a hospital administrator. The purpose of this team is to work collaboratively into achieving the goal of the program and to help young adolescents who are pregnant deal with the new journey that they are facing, as well as to help others avoid falling pregnant without planning. In this community team, the nutrition professional will educate expectant mothers about healthy prepartum and postpartum diets and nutrition that is essential for them to provide for their infant during pregnancy as well as to recover after delivery. The psychologist will help these young adolescents talk about their experiences and will also be able to identify red flags that need to be addressed. The school principal will raise awareness in schools about being safe and sexual education. The health worker will help counsel the adolescents and provide them with supportive decisions about what they want to do next. Local advocates will provide information about the reality of the issue that is being studied, and the local business leader will find the appropriate funding and the appropriate budget plan for this program. The community of interest is pregnant adolescents that are aged between 13 and 15 years in the Luna County, New Mexico, with low socioeconomic status. Luna has the highest rates of teen birth in New Mexico, with 54.5 births per 1,000 teenage girls in the population. Unfortunately, teen pregnancy in the United States has been on a rise to women aged 15 and 19 years old. Many pregnancies, however, are not planned nor wanted, and it is reported that this is due to inaccessibility to contraception. However, adolescent pregnancy has a lot of risk, of which can be eclampsia, maternal mortality, low infant birth weight, preterm delivery, and neonatal conditions. Therefore, implementing a teen pregnancy prevention and awareness program is essential to help those adolescents finish their high school and pursue a higher education for a better quality of life. That said, a recent evidence-based public health program showed that teen girls who have babies are less likely to finish high school or attend college and are more likely to rely on public health and therefore live in poverty as adults. Every year, around 21 million girls between the ages of 15 and 19, and 2 million girls under 15 years old become pregnant in developing countries, and those numbers are quite shocking. Therefore, teen pregnancy is a public health issue that need to address rapidly. Babies born to adolescent mothers are at higher risk for low birth weights, increased infant mortality, increased risk of hospital admission, less supportive home environments, poor cognitive development, and their daughters also have a higher risk of falling pregnant themselves as teenagers. The risk factors that increase teenage pregnancy prevalence include the following: such as living in disorganized neighborhoods, low socioeconomic status, educational status that is low, living with a single parent, a history of sexual abuse, disrupted family structure, early sexual initiation, and having multiple partners, as well as no use of contraception. As mentioned, this is the community of interest. The state of New Mexico has the third highest poverty rate among all states for children aged 0 to 17 years, and it was ranked as the 7th highest state with teen pregnancy prevalence in 2016. Poverty has been a consequence of teen pregnancy, where 1 in 4 young women, mothers, enroll in welfare program. Luna County, New Mexico has a poverty rate of 31.8%, which puts a lot of individuals below the poverty level and therefore increases the risk of becoming pregnant as teens. Another issue is food insecurity. Food insecurity is basically lack of access to constant or enough food in order to provide healthy and adequate intake for members in a family. Luna County, unfortunately, in New Mexico ranks among the highest percentages for food insecurity for individuals. Another issue to be tackled is teen pregnancy and education. Higher levels of education have been linked with higher use of contraception. Therefore, individuals who have lower education are at a higher risk for falling pregnant. Key informant findings. The key informants in this community of interest assessment are the individuals who are pregnant and have passed or are passing through the issue being studied. The information that they give will provide a deep insight into the reality of the situation at hand. The reasons that led teenagers to fall pregnant were peer pressure, sexual abuse, lack of sexual education, and lack of access to contraception. The teen concerns that were collected from the key informants information during pregnancy were a lot. Basically, among them were not eating well during pregnancy, what would they have to give up, and the option of adoption that they will have, and the parental fear of what has to come next. This teen pregnancy prevention program will aim to decrease teen pregnancy rate in the next 5 years. It will aim to raise awareness about sexual education among young adolescents. It will raise awareness about the importance of the use of contraception and the importance of social and familial support among adolescent families. And it will also work on educating adolescents about proper nutrition during pregnancy and after delivery. The interventions will be the following. Seminars in schools will be held to teach kids about safe and comprehensive sexual education. Condoms should be readily accessible. Pregnant teens shouldn't be granted early delivery discharge until they have decided what to do next, so that the baby is ensured to be properly taken care of. Educational workshops should be given to pregnant teens about healthful nutrition, and teens should be told about their options that are available for them after pregnancy. This program has a strength, and it will be providing teens with accessibility to affordable and healthy foods, since the rates of poverty in Luna County are high, which puts the teens at a possible inability to access healthy foods during pregnancy. The provision of access to healthy foods will therefore ensure that teens with the proper education and awareness provided to them will be able to have a healthy pregnancy and recover fully postpartum. With this program, there are high hopes that the situation of teen pregnancy will be made better and that teens will be more aware about the importance of being safe and engaging in safe sexual activities. My presentation was comprehensible and that everyone enjoyed it. Thank you very much.